The views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Public Health America, a 30-minute program on BronxNet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents, but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college, but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. It is my absolute pleasure to welcome Dr. Qiana L. Brown to our program. She is an epidemiologist, translational scientist, social worker, and assistant professor at the director of the Substance Use Research, Evaluation, and Maternal and Child Health Group at the Rutgers School of Social Work Center for Prevention Science. Dr. Brown's research focuses on prenatal substance use and has been published in top-tier international public health and medical journals. In 2019, she was named a Woman of Future Influence in Addiction Science by the Society for the Study of Addiction. Prior to joining Rutgers, Dr. Brown earned her PhD in mental health and drug dependence epidemiology from the Johns Hopkins University and completed a postdoctoral research fellowship in substance abuse epidemiology at Columbia University. She also founded and directed a nonprofit community-based substance use disorder treatment center for women, Jane's House of Inspiration, in honor of her late mother. Welcome, Dr. Qiana Brown. It is a pleasure to have you on Public Health America.
I'm so happy to be here with you, Dr. Latimer. Thank you for having me.
You're very welcome. So if it's okay, let's just break through and please call me Bill. And if it's all right with you, I'll call you Qiana.
Certainly all right with me.
Very good. And truth in advertising to our audience, amongst your long and esteemed career and training, you actually did some work with me during your doctoral work. So we've known each other for a while, and it's such a pleasure to have you as a guest. So you do quite a bit of a wide range of research, but I think today we're going to focus on prenatal substance use, particularly cannabis or marijuana use among pregnant women, an incredibly important topic. So if you could just sort of set the table, what are some of the work you've done, and what are the overarching issues at play here that we need to be thinking about?
Yes, so my research does focus on prenatal substance use. Well, more specifically, I examine substance use during preconception, pregnancy, and lactation. I try to understand why people are using drugs and alcohol during that time so I can prevent it. And my current research is focused on prenatal cannabis use. And what we're seeing in the United States, because I take a population health perspective to my work. So in the United States, cannabis use, prenatal cannabis use is increasing despite potential health risk to mother and child. And this should be concerning from a public health and prevention standpoint.
So that's a great intro. Let me ask you this. I think what could be on people's minds are a lot of questions. Let's start with the specifics. You mentioned risk to the mother and child. So now let's make the parameters clear. We're talking about a pregnant woman who's using marijuana or cannabis. What is the risk to the mom? What is the risk to the fetus?
That's a great question. So research is certainly still developing in this area. And what we see right now are associations. So we see that cannabis use, prenatal cannabis use, is associated with maternal anemia, low birth weight, neurodevelopmental deficits, just to name a few. So we need more research to actually examine these associations over time.
And you make me think, is there any data out there, like if we were to compare marijuana use, cannabis use to, say, cigarette use or to alcohol, is there any sort of, like when I think of cannabis use, typically you'd be smoking that, cigarette, you'd be smoking that, obviously with alcohol, you're drinking that. Let's start with cigarette and cannabis. Are there similarities in terms of the negative outcomes, or are they actually different because of the nature of the substance? Or do we know that?
Bill, I think that's the million-dollar question. The current state of science, most studies, the question is whether or not we're controlling for confounding, right? Whether we're controlling for tobacco use. So when we see associations between prenatal cannabis use and maternal and child health outcomes, the million-dollar question is whether those associations are really due to tobacco use. Some studies, many of which are cross-sectional, so we can't really tell what came first, the chicken or the egg, or in the top science terms, the exposure or the outcome. We are seeing that there are associations between cannabis use and poor maternal and child health outcomes, even after controlling for tobacco use. But important to keep in mind is that associations are not causal factors per se. We need more research to dig into the details.
So just for the service, in the service of informing our audience, you mentioned the distinction between, say, association with a cross-sectional study versus having a more causal understanding of an impact via a longitudinal study, again, where the exposure in this case is marijuana versus tobacco, and the outcome is, say, low birth weight. Walk us through, let's say you're talking to the person on the street or me, and you want to explain the difference between the cross-sectional and the longitudinal. Give us a thumbnail on that difference.
Right. So great question. So in a cross-sectional study, I'm measuring everything at the same point in time. I'm asking, for example, a population of pregnant women whether or not they used cannabis, and at the same time, during the same period, rather, I'm also measuring low birth weight. So I don't really know what came first. I may be assessing a lot of other factors as well, such as tobacco use, health insurance status, and potential confounders. But the point is, I'm measuring everything at one cross-section, one point in time, in order for me to examine whether cannabis caused a poor health outcome, be it a maternal or child health outcome. I would have to measure cannabis at time point 1 or prenatal cannabis use at time point 1. And then maybe sometime later, 9 months later, once the baby is born, I can examine low birth weight, for example, controlling for a bunch of other factors that may also contribute to both cannabis use and low birth weight.
Got it.
And what we have now in the research is more cross-sectional studies than longitudinal studies.
And that's just where I was about to go. Is it fair to say in a nutshell that you have more confidence in the findings of a longitudinal study than one does in a cross-sectional study? That's not to say cross-sectional studies don't have a purpose, but that you have more confidence in the longitudinal. Is that fair?
General rule of thumb, sure. We have more confidence in a longitudinal study, but that's really an oversimplification. What we need is well-controlled longitudinal population-based studies. So it's not helpful, relatively helpful, if I have a longitudinal study of 15 people. I need a longitudinal study of tens of thousands of people, diverse populations that control for not only individual characteristics, but environmental factors. Then I can examine in depth whether or not cannabis use, prenatal cannabis use, causes poor maternal and child health outcomes, accounting for the neighborhood, accounting for personal characteristics, accounting for social determinants of health. So all longitudinal studies are not created equal, is what I would say.
Gotcha. So let's change gears with the time we have left to policy. Sure. I know that you're passionate about what happens to women who are pregnant when they're using cannabis and the importance of screening for cannabis use when they're going to their OBGYNs or their various docs. Where do things stand? We know that nationally, many states have decriminalized or have legalized marijuana use, but amidst all this is just everyone's day-to-day lives where pregnant women are sometimes using cannabis. So what are your thoughts on that? What's the state of public policy these days?
This is a great question. The state of public policy is incongruent when we're considering legalization of cannabis use and policies that criminalize prenatal substance use. More than half of all states and the District of Columbia have legalized cannabis for either medical or recreational purposes. However, half of all states still consider prenatal substance use child abuse and require healthcare professionals to report suspected substance use amongst pregnant women. This is the time now to repeal antiquated policies that criminalize prenatal substance use, to include prenatal cannabis use, in effort to move towards holistic care, treatment, prevention, health education. Using substances during pregnancy is no more of a crime than having diabetes during pregnancy.
Got it. So again, I'm loath to oversimplify, but Qiana, is it fair to say that if I am a pregnant woman, it's probably best that I don't use cannabis / marijuana? That said, if I'm a healthcare provider treating a pregnant woman, I want to be working in a system where I can provide the assistance needed, treatment, preventative care, et cetera, in a manner that doesn't put the woman at risk to go to jail or lose her child. Is that fair?
That is fair to say. We need education not only for pregnant mothers on the potential risk of cannabis use during and around the time of pregnancy. So during preconception, pregnancy, and lactation, the American College of Obstetricians and Gynecologists recommends such education, and even the recent Surgeon General's advisory recommends health education on this topic. We also need to educate our providers on the risk or potential risk of prenatal cannabis use, so everyone can be on the same page. So in short, the current recommendations are that women who are pregnant, are planning to become pregnant, or who are breastfeeding abstain from cannabis use, because there's just not enough research on the causal effects of it, and the current state of science shows strong associations between prenatal cannabis use or cannabis use during and around the time of pregnancy and poor health outcomes.
Excellent. Thank you, Qiana. We're taking a quick break, but when we return, Dr. Brown will tell us a little bit about her journey academically and personally that led her to this exceptional career and work that she's doing. This is Public Health America. I'm Dr. William Latimer. Welcome to Public Health America. I'm your host, Dr. William Latimer. I'm here with Dr. Qiana Brown. Qiana, it was great to hear about your work with prenatal cannabis use. Obviously, a really important topic. You know, I've been an academic, or I've been an administrator for 30 years, and I've always believed that we see scientists, brilliant scientists like yourself, on these kinds of interviews all the time, and yet what no one gets to see typically is kind of just the story behind the story. And really what Public Health America is trying to do here is to let the community know that we're all just people, and that people have faced challenges, and that those challenges were met, and that enabled you to sort of take the support you had and do something like go to college and then form a really wonderful career for yourself. And so the purpose of our second segment is to just talk about that history with a wide variety of guests, and see if we can sort of figure out some life lessons that will help people in the community today to realize their own dreams and advance their own journeys. So with that said, Dr. Brown, Qiana, tell us, where were you born?
I was born in Philadelphia. I'm from North Philadelphia.
Wonderful. And tell us just a little bit about your upbringing. Where'd you go to school? Anything you want to share with us about that?
Sure. I went to public schools in the Philadelphia school system. I grew up in a loving family. I was raised by my grandmother, and this is my wonderful mother, Jane Lee Britton. So you can see in this picture, she's the life of the party oftentimes. So this is my uncle. He raised me just like a father. This is his daughter, my cousin, who, in many families, first cousins are like sisters. This is my wonderful grandmother who raised me from the age of 6 years old, Mrs. Ruth Revere. And that's me. That's at a birthday party. Oh, this is a picture of my mother on the bottom, my bottom right. This is my mentor, my college mentor, Dr. Denise Davis May. Wonderful pictures to choose from.
That's great. And is that mostly or all in the Philly area in terms of the growing up photos?
Oh, yes. The growing up photos are all in the Philadelphia area. Of course, my college mentor, that's just a photo of her somewhere in her professional career. But the picture of my mom, the beautiful picture of me and my mother, that's actually my mom in recovery. I went to visit her in substance use recovery. And you can see just from that photo, the face of addiction is not what we may paint it to be. There's a lot of stigma around substance use, but you don't often see the public doesn't often see the beautiful person that lives with addiction. And so I'm glad you chose that picture so I can showcase my life of the party mother in recovery.
Absolutely. A wonderful photo. Qiana, so let's fast forward. You go to public school. When you graduate from high school, what did you see as options? What were challenges that you faced at that time? And where did you initially go? What did you initially do post-high school?
So I went to the Philadelphia High School for Girls. It's a magnet school in Philadelphia. I applied to colleges like many of my classmates, and I received scholarships like many of my classmates. But my concern was being able to survive beyond the scholarship. What would I do as a girl, girl growing up poor in Philadelphia if life happened in college? How would I take care of myself? How would I provide for myself beyond the scholarships, beyond the financial aid? I thought work study certainly wouldn't provide anything for me but a few dollars in my pocket. So because of that, I decided to join the Army, and I became a nurse in the military. And afterwards, I worked my way through college as a nurse. A nurse and an EMT, actually.
That's great. So tell us a little bit about, so you go to the Army, you get training as a nurse. You're there for 4 years. Were you stationed in the US or were you stationed elsewhere?
I was stationed in the US, and I was also stationed at Walter Reed during 9/11. So it was, it, I wasn't able to actually speak about that for about 8 years and after I got out of the military. So.
Mm-hmm. And then what led you to move from the military, and what was your next step?
I went to college and majored in psychology, not so much because I wanted to become a psychologist. I wanted to be anything that would allow me to address addiction. So I figured I would start as a psychologist.
Yeah, that's great. So tell us about the transition from your master's work to your doctoral work. What was going on then?
That's a great question, Bill. And the way that I like to see my journey to my doctoral training is not so much from master's to PhD or college to PhD. It's really from Army to PhD. I think that captures the full trajectory. And joining the Army for me prior to joining college, entering college, made a huge difference.
That's so great. I mean, Qiana, your story is in some ways so unique and so wonderful. I mean, when I was at Hopkins with you, we were deliberately recruiting community college students from Prince George's and Dundalk Community College. And this was not by design. 100% of them were veterans. 100% of them were first generation college students, and most were students of color. And they were being partnered with Humphrey Fellows from Iraq and Afghanistan, which is where they had served. And I know that your military service, in particular, your nurse training, was so critical to your formative experiences. So how does that weave into your decision to, like, at what point did you say to yourself, I can get a doctorate and I can become this amazing person? We already were an amazing person, but I can become this academic at a major R1 institution in Rutgers. When did that happen?
That's a good question. And it all goes back to my journey. I view my journey from Army to PhD as chasing the drug. I didn't set out to be a nurse any more than I set out to be an epidemiologist and translational scientist. I wanted to enter any career path that would allow me to address addiction. So beginning my career as a nurse and going on to receive a terminal master's degree in both social work and public health, I was effectively a practitioner. And I loved it. I absolutely loved it. And when I went into practice, not only my own private practice, but working for different agencies, I realized there was a gap in my ability to be able to address addiction from every angle, from research to practice. I had the practice-based experience. I did not have the research-based experience to the level that I wanted Of course, I had an MPH and an MSW, but I wanted more. And that's when I decided to go for my PhD.
Great. And then I was fortunate enough to recruit you to Johns Hopkins School of Public Health to do your doctorate there, and you did exceptional work. Let's fast forward to your doctoral work, to your postdoc work. I can't tell you, Qiana, and you mentor students now. I mean, there are so many students that do their undergrad and then say, all right, I'm going to stop and get a job. And that's fine. But 9 out of 10, I'm saying, go get your master's. And then there I'm saying, go get your doctorate. And then I'm saying, do a postdoc, and then check out the lay of the land and see what your options are. You elected to go from your doctorate to a postdoc. What led you to choose that path?
Bill, I am going to answer that question, and I appreciate that you've asked it, but you fast forward past the significant role your training program played in my life and in my research career. So when I got to Hopkins, you were one of the few principal investigators in the country that had a Center for Addiction and Pregnancy. You had the what we call the CAP data. Up until that point, my academic career was me trying my best to piece together work on maternal and child health and addiction. So when I got interviewed with you in your lab, I thought you were playing a trick on me and that the fellows were playing a trick. I said, there's no way that he has actual data on addiction and pregnancy. And I just fell in love. I knew I had to be there, and we published papers together. And that was the start of the research career that I actually wanted. And that is what put me on path to a postdoc. So when I interviewed for my postdoc, I knew exactly what I wanted to do: addiction, pregnancy. That's my research trajectory. So when I interviewed at Columbia, Dr. Deborah Hassan was recruiting me to her drug dependence epidemiology program. And because I conducted research, phenomenal research with you, I think that made me a competitive applicant for the drug dependence epidemiology program at Columbia University.
That's exceedingly kind, and I deeply appreciate it. You know, you remind me, it's been a bit, but that was that CAP addiction and pregnancy grant was a specific RFP that NIDA put out that we were fortunate enough to get, and then you came on board and were a critical part of. And let me also say that, you know, Deb Hassan has one of the greatest postdoc and pre-doc training programs in the country. So it was so great to see you progress from Johns Hopkins to Columbia to where you went next. So just to wrap up, I mean, what an extraordinary journey and all the amazing things you've done. If you could say one thing to a high school student in the Bronx to motivate them to go to college, what would you say?
That you can make it. Don't give up. I know that as first-generation college students growing up in some urban areas that are underserved in a lot of different ways, we face challenges that other students or other people just don't so early in life. But you can absolutely make it through that phase of life and accomplish all of your goals.
I cannot thank you enough, Dr. Qiana Brown, for joining us on Public Health America. I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. Take care. See you next time.